Straight away, it's going to make your job so much easier. It might take, if you're not used to digital systems previously, it might take a little while, but once you get used to it, you sort of become an expert for your company as well.
There's so many benefits. I feel like technology is a good thing. If used appropriately, it will bring a massive change to the care system.
My role is to look at different systems and processes to see how we can improve the care that we deliver to our service users. That will involve me going to the market and looking at what systems will be fit for purpose, how they will fit into our organisation and what benefits we will get. I'm also looking at what value it will bring to the organisation.
So the motivations behind introducing technology, especially new technology, is more around, as I say, the resident care side. Can we improve the quality of care? Can we make everybody's life easier whilst they provide that care?
A lot of family members and service users can find it quite out of the ordinary, and they want to keep with the paper, but we just have to encourage them that, and show them the benefits of electronic care planning systems. So on the initial assessment, it's one of the questions that we'd ask, whether they consent to the family member having access to the care notes. So if they say yes, they have to sign for it, and then the family member that they've consented to can then access the care notes from wherever. Obviously, if the service user says no, then the family member's got no way of overriding that, and they can only see the care notes when in the home if the service user allows them to.
In care, it is very important that you have up-to-date care, records of your clients. Don't forget, we're not only dealing with them as just human beings, we're dealing with their medical records, their day-to-day life. So having up-to-date records on them is very important.
The benefits that the system provides to us are that we get complete visibility about the service, so we can look at punctuality, we can look at if calls are overrunning or even if they're underrunning. It allows us to be proactive rather than reactive.
I know lots of providers of various technologies will give you referees, if you like, that you can contact. I did the same before we chose our provider. I contacted other homes to find out what they thought of the system, and they offered for me to go and visit, to have a look round and actually see it.
We mainly use sort of video calls to make sure that we can get access to people as quickly as we need, especially being able to just call someone is so much simpler than having to go and find them.
It's communication with loved ones, so if they can't come in to visit, you can obviously do sort of like calls, virtual calls with them, connectivity with family members, and we encourage that. Again, likewise, we will have GPs will do teleconferences with residents to save them actually coming in to see them. District nurses, other health professionals will actually use technology to that advantage as well.
In terms of having video calls and things, a lot of the residents don't have family that can travel or that can get here because they're at such a distance, and having those video calls there really makes a difference to that resident's day. You can see the change in them when they've had that conversation with their family. They're a lot happier, they're a lot more engaging, they want to do things because they've had that little bit of a conversation with their family. And with having the ability to access the internet and go onto systems, it just gives them that chance to sort of grow with us, because of course a lot of these residents have not had the experience with technology that we have, so it's nice to be able to sort of update them and show them how it works, and a lot of them really take to it as well.
When I put into the system who's done the training, it's under a date when that training was done, and as the years go by, it flags up who needs training, when they need it, and when they did their training, so it gets booked. So the benefit is fantastic.
From a training side, technology is really important to us. We have our own online learning platform, which allows staff to access a whole range of clinical courses, non-clinical courses, leadership and management courses. Actually, for us, our online learning platform is an absolute blessing.
It might look scary, but once you've played around with it for a little bit, it's actually quite easy, and when you've got the support around you that you have, it's not as daunting as it thinks. So I think, just sort of having a bit of confidence in yourself.
I think when we look back now to the benefits that using digital systems has brought, it's massive, and because of that, what I often find now is that my team say, oh, we've come across this system, it could be really good for our organisation. Gary, do you want to go away and look at it? And I will go away and involve them and look at what that can maybe bring into the organisation and see how that can help us. But nowadays, with technology, we can do Microsoft Teams meetings, we can hold events virtually, we can send out information via apps, so it increases the availability of how we can reach our workforce. So that's definitely been a plus point of introducing technology into the organisation for sure.